Okay, let's put a timer of 28 minutes. Mm, Let me just turn. Hmm, Yes. So we were doing what were we doing? We were doing anti-epileptic drugs. So so yeah. So GABA is actually a major inhibitory hormone. GABA, glycine, they are all inhibitory hormones. Neurotransmitters in the brain. So barbiturate like phenobarbital, primidone, primidone, and benzodiazepines also, BDZ, diazepam, clonazepam, clobazam. They activate GABA activated receptors by binding to benzodiazepine chloride channel complex. There's also ganaxolone, ganalo- ganaxolone, ganaxolone. It's a ganaxolone. It also acts by activating this channel, but the binding site is different. So the drug can also act by increasing the release. Like basically, ganaxolone, it's a neurosteroid. So what happens is it acts by activating this channel, but binding site is not as GABA, benzodiazepine, or barbiturate, but it's different. Like different binding site is there for ganaxolone. Now uh, drugs they actually increase the release of gabapentine, decreasing the metabolism, obviously vigabatrin, and inhibiting the reuptake is tiagabine. Yes, because we read here. The heck? Hmm. So it is inhibiting this vigabatrin is inhibiting the metabolism. Tiagabine is inhibiting the reuptake, and what was the sorry, what was the other one? Yeah, gabapentin release. It is increasing the release. So yeah, so decrease in excitatory neurotransmitters. So glutamate, aspartate, and major excitatory amino acids in the brain. So what happens is glutamate can act by stimulating metabotropic or inotropic receptors. So kainate, NMDA, and AMPA. Felbamate acts by topiramate acts by inhibiting kainate receptors. Perampanel is AMPA antagonist to topiramate, inhibiting the NMDA receptors. क्या बोल रहे हैं excitatory. So glutamate and aspartate ये करते हैं. Glutamate can act by stimulating the metabotropic GPRS or inotropic receptors, kainate and MDA and AMPA. Falbamate acts by inhibiting NMDA, and topiramate acts by inhibiting kainate receptors. And parallel to ये तीन है felbamate NMDA receptors inhibit करता है. Then topiramate, it inhibits the kinase receptors, and parampanel, it inhibits the albumin, topiramate, inhibiting calcium channel. So T-type calcium channel is important in absence seizure. T-type. T-type channel receptors. They're important in absence seizures. Drug inhibiting these ethosuximide. That is why in absence seizure we do not use phenobarbital. Sorry, phenytoin. Phenytoin नहीं यूज करते हैं हम ethosuximide, valproate और lamotrigine यूज करते हैं because T tubules, calcium channels, they are important. So petite mal epilepsy is another name for absence seizure. Gabapentin and pregabalin, they bind to alpha to delta 2 subunit of presynaptic calcium channel, and they act by unknown mechanism. Gabapentin और pregabalin का पता ही नहीं है क्या होता है. Although in here pregabalin and gabapentin हमने देखा कि ये रिलीज वो करता है, रिलीज इंक्रीज करता है, but इसका mechanism how it releases it, how it increases the release is unknown. Mechanism of action of anti-epileptic drugs. So prolonged inactivated state of sodium channel. इसको क्या क्या करता है? Inactivate कर सकते हैं हम sodium channel को, and uh, we can also open the potassium channel so that depolarized state maintained रहे. तो retigabine और topiramate है. These are the two. And for prolonged inactivation of sodium channel, we have phenytoin, phosphenotoin, carbamazepine, oxcarbamazepine, valproate, divalproex, lamotrigine, topiramate, यहाँ पे भी है, zonisamide, lacosamide, rufinamide. And we are decreasing the glutamate activity because it's an excitatory neurotransmitter. So it's lamotrigine, tropamate, topiramate, perampanel, felbamate. तो felbamate कहीं और नहीं पढ़ते क्या? हाँ, यहाँ पे पढ़ा था ना, felbamate. Yes, NMDA receptors वो करता है. Felbamate, topiramate, kinase receptors, and perampanel, AMPA receptors. Lamotrigine तो ठीक है. Increasing the GABA activities, valproate might increase the GABA activity. Topiramate will also increase. Ticagrelin, हाँ तो हो रहा है ना, barbiturate, benzodiazepine. T calcium जो है था ethosuximide, valproate and zonisamide. Also there was one more, right? इसमें था ना कि lamotrigine also. It's not given here. Now in completely understood mechanism is brivaracetam, levetiracetam binds to S2A, brivaracetam, gabapentin, pregabalin bind to and lacosamide. What are the important drugs? So important drugs are barbiturates में हम use करते हैं phenobarbital and primidone. They act as anticonvulsant drugs due to GABA mimetic as well as GABA facilitatory. ये तो हर जगह पे लिखा है. They are GABA mimetic and GABA facilitatory properties. These drugs increase the duration of opening of the chloride channels. So these drugs are useful in generalized GTCS में use होता है. Phenobarbital and pyramidone. I just hope. Yeah, and also partial seizure. Partial seizure में भी हो सकते हैं, generalized tonic-clonic seizure में भी use कर सकते हैं. These drugs are contraindicated in acute intermittent porphyria. So acute intermittent porphyria में why it is contraindicated is because जो porphyrin को that there is a trans synthase. There's a synthase, tyramine synthase, कुछ तो ऐसा होता है as far as I remember. तो वो it's a rate limiting step and that is actually inhibited. So so it's limiting the rate. No, it's inhibited. So you complete produce होता रहेगा. तो acute intermittent porphyria में that's why it's contraindicated. So these drugs can cause paradoxical excitation in some patients. Excitation produce कर सकते हो although they are depressive drugs. They are for hypnosis and sedation and all, but a paradoxical excitation in some patient it can cause. And phenobarbital is a drug of choice for GTCS in infants, but can cause hyperkinesia in older children. So phenobarbital is actually a drug of choice for GTCS in infants. Drug of choice for GTCS and hyperkinesia in older children. Okay. Now benzodiazepine, BZD, BZD. Diazepam and clonazepam, lorazepam, clobazam, they're all benzodiazepines that we know. Like by GABA facilitatory activity, and these drugs increase the frequency of chloride channel opening. So diazepam and lorazepam, clonazepam, they're all useful for the management of acute seizures. Acute seizures. These can also be used IV for status epilepticus. So what have we learned is diazepam, lorazepam, and clonazepam DLC. Therefore, there can also be for status epilepticus, although lorazepam shogi hai, that is the drug of choice. Now, diazepam is given per rectal route. Per rectal route is DUC for febrile seizures. Febrile seizures में हम diazepam देते हैं per rectal. So, but benzodiazepine also have prominent sedative effects like barbiturates. We are doing benzodiazepine. Tolerance develops due to anti-epileptic effect. So these are not indicated for long-term use. Obviously, in some way, the tolerance will develop. That's why even if we are stopping the drug, we have to taper the doses because then the क्या तो था will cause psychotic symptoms. It will cause we stop suddenly. Now, phenytoin, it is non-sedating oral anti-epileptic. Phosphenytoin is basically a water-soluble prodrug of phenytoin. Phosphenytoin. It's a prodrug of phenytoin. Parenterally administer करेंगे IV और IM. Acute attack of seizures में हम देते हैं ये status epilepticus. These drugs act by blocking the use dependent of sodium channel. Phenytoin is useful in GTCs and partial seizures, obviously. It can also be used as antiarrhythmic drug, class 1B. इसकी classes थे ना, 5 classes थे rhythm में आके. So for the treatment of digitalis induced, so the digitalis induced arrhythmia, then we can use phenytoin. Recently, it has been found that enhance the wound healing also. Phenytoin induces wound healing. These drugs follow saturation kinetics. तो क्या होता है kinetics changes from first order to zero order within the therapeutic concentration. अगर किसी डोज में it will be in first order, किसी डोज में it will be in zero order. So saturation kinetics is shown. Now phenytoin from different manufacturers, different brands have different bioavailability and therefore brand changes can lead to toxicity and suboptimal levels also. So we have to check the like phenytoin is given with the like it's given weight wise and age wise, weight wise and dose wise. Phenytoin का ये सब check करना होता है. At toxic plasma level, oral dose phenytoin can result in cerebral symptoms like ataxia, vertigo, nystagmus, and diplopia. Phosphenytoin should be given by following by slow IV infusion because fast administration of high doses can lead to arrhythmias, cardiovascular collapse and coma. Prolonged use of phenytoin can result in gingival hyperplasia also. This is a very important thing. Gum, gum hypertrophy it results due to overexpression of the platelet-derived growth factor. It may regress after discontinuation of the phenytoin. Other adverse effects on long-term use include hirsutism, so hair on face, coarsening of the facial features, galloblastic anemia also, but it can be treated with folic acid. Vitamin D deficiency can occur, vitamin K deficiency can occur, and hyperglycemia can occur due to inhibition of the insulin release, hypersensitivity, and teratogenic activity also is there. So fetal hydantoin syndrome, hypersensitivity, and teratogenicity, and hypoplastic phalanges, cleft lip and palate, and microcephaly. सो फीटन हाइड्रोटॉइन सिंड्रोम इसमें क्या क्या होता है हाइपरप्लास्टिक फ्लेंजेस होते हैं क्लेफ्ट लिप एंड पैलेट एंड माइक्रो फेस छोटा होगा देयर बी क्लेफ्ट लिप एंड पैलेट कंडीशन होएगा and hypoplastic phalanges are also like seen. Now, osteomalacia may not always be ameliorated by administration of vitamin D because vitamin K dependent proteins also play a role in the calcium metabolism. So vitamin K जो है actually this also calcium metabolism में भी ये help करते हैं तो osteomalacia में it's not that कि vitamin D deficiency होगी but vitamin K dependent proteins they will also play a role in calcium metabolism. So lymphadenopathy. Next is lymphadenopathy or pseudo-lymphoma or malignant lymphoma. IV phosphoenolone should be given slow IV infusion with okay. Lymphadenopathy, so pseudo-lymphoma and malignant lymphoma. Um, so lymphadenopathy or pseudo-lymphoma and malignant lymphoma. So they are associated with reduced IgA and when immunoglobulin A is reduced and inhibition of ADH release. Oh my god, फिर से headache होने लग गया. At least दूसरे region में हो रहा है. Okay, inhibition of ADH release in ये क्या था? I know it's something inhibition of ADH. but ठीक है. Yes. काले दिल बाज़ शौकीन कुड़ी दूर दूर जावे मेरे काले रंग तो काले दिल बाज़ शौकीन कुड़ी. Malignant lymphoma associated with this thing. Now, phenytoin should be stopped gradually because discontinuation may result in precipitation of the seizures and it's also potent obviously. So because GPR is cell phone में graceful है ना तो phenytoin ही तो है काले दिल वाली शकीन न करी दूर दूर जावे मेरे काले रंग तो काले दिल वाली शकीन न करी. So hot Malika इसका है Hiracid hot Malika है इसका adverse effect of phenytoin is parasitism, hypertrophy of gums, or stimulation है teratogenicity. Hot हो गया और stimulation ना megaloblastic attacks and nystagmus, lymphadenopathy and in vitamin K deficiency in arrhythmia. This is carbamazepine, oxcarbazepine. So actually, actually these drugs act by blocking the use of sodium channel. Use dependent sodium channel. So oxcarbazepine is similar efficacy but less toxic than carbazepine. So these are the drug of choice for partial seizure and can cause and are also used for GTCS. So carbamazepine is used for trigeminal neuralgia, obviously. That is where we have read it, and can also be used for glossopharyngeal and post-herpetic neuralgia. So basically, all the kind of neuralgia. Another use for so only benefit is that efficacy similar है but toxic कम है oxcarbazepine carbazepine से. Another use for carbazepine is treatment of the bipolar disorder, which is manic depressive psychosis and also is an antidiuretic and DI. क्या है? Diabetes insipidus. It is potent enzyme induces and can induce its own metabolism, thus requiring more dose if used for long term. Yeah, actually. Also like इसको तो बढ़ाते बढ़ाते जाना होता है like 1600 to 1200 तक कर सकता है guess 1800 तक शायद से. It's a potent. Major adverse effect of these dizziness, headache, ataxia, vertigo, and diplopia. It can also cause rash, leukopenia, aplastic anemia, Steven Johnson syndrome. These are them. Rash, leukopenia, and aplastic anemia. Rash है. Rash should be like one big thing. Aplastic anemia, obviously. Leukopenia, ठीक है. Steven Johnson, SJS, and hepatotoxic congenital malformations are induced in to female taking this drug. So if the females are pregnant and they're taking these drugs, carbamazepine, so congenital malformation will occur in children. Carbazepine is a sodium channel blocker indicated for adjunctive treatment of focal seizures. So if we have to adjunctive treatment, if we have focal seizures, तो हम एस्ली कार्बाजेपिन भी दे सकते हैं साथ में. Valproic acid. Okay, so it's a broad, obviously. It's effective in all kind of seizures, and it acts by several mechanisms, including blockade. Sodium को भी block कर देता है, increases activity of GABA also due to stimulation of glutamic acid decarboxylase and decrease in metabolism by inhibiting the GABA transaminase. And it also inhibits the T-type calcium channels. Sodium, okay, सोडियम को करा, ठीक है. देन उन्होंने किसको करा, देन उन्होंने इंक्रीज एक्टिविटी ऑफ गाबा, ठीक है. स्टिमुलेशन ऑफ ग्लूटामिक एसिड डिकार्बोक्सिलेज इसको भी करा, डिक्रीजिंग metabolism and inhibiting GABA transferase. Now inhibiting the T type calcium, the तीन activity तो already हो रही है, decrease the release of glutamate in the brain. And DOC is in GTC is myoclonic atonic atypical absent everything सब में ही use होता है. It is also effective in Lennox-Gastaut syndrome, and it's a special syndrome that we will learn about. जैसे टीवी सीरियल में वो नहीं आते, प्री कैप और ये होने वाला है, and we all get excited and want to read more, want to see more, watch more. तो वैसे ही ये भी आ गया है यहाँ पे. We want to learn about it, but ये बाद में आएगा इसके बारे में. So absent seizure, absent seizure तो है ही, infantile spasm also and partial seizure ये भी तो है ही, एक्स्ट्रा मेंशन करने की क्या जरूरत थी. क्या था, हम यहाँ पे क्या पढ़ रहे थे, फीवर वाला कुछ था. वेट, फीवर वाले में क्या था, फीवर वाले के लिए अलग फेब्राइल सीजर्स के लिए डायज़ेपाम एंड पर रेक्टल यूज करते हैं फेब्राइल सीजर्स, तो डायज़ेपाम भी यूज. इट इज यहाँ से it it should be gradually stopped to avoid withdrawal seizures. Other uses of this drug include bipolar disorder, prophylaxis of migraine. Oh, migraine के लिए use होता है. I could use it. Valproic acid. And as an alternative to carbamazepine and trigeminal neuralgia also. So recently it has been seen to be used in tardive dyskinesia. Okay Google. Okay Google. चल क्यों नहीं रहा?